At the heart of Kampala stands Mulago Specialized Women and Neonatal Hospital, a center of excellence dedicated to advancing women's health, neonatal care, and medical innovation. Guided by visionary leadership, the hospital serves mothers and newborns from all regions of Uganda, ensuring access to quality, specialized services.
As the name stands, it is a specialized hospital for women and the newborns. Now, there are a number of services which are offered to the women, and they range from the time before they conceive, what we call the prenatal care, when they are pregnant, through childbirth, and then in the postnatal period, including even immunization of the children. We also offer services related with the treatment of women cancers. Those are cancers of the womb, cancers of the cervix, and cancers of the genital parts, including basically the ovaries. And we also treat other women conditions like fibroids, for example, or tumors related with the reproductive system. But the big on the list of the women is services related with the women who have challenges with conceiving. In addition, we have very critically, very young babies delivered less than 26 weeks. We have babies of 30 weeks delivered, and they come with very small. And since the hospital started, we have helped so many parents to go home with a baby who has survived because he was delivered preterm. But in addition to the specialist doctors, we have nurses who are trained in supporting the doctors in place. But we also have the supportive laboratory system, what we call the investigations. Our lab is fully functional, and we're able to do a number of tests. We're able to do X-rays, imaging in our facilities without sending patients actually outside. So we're proud of our team, which is on the ground, the doctors. We're proud of the nurses who are on the ground, and all the supportive staff available in the facility to provide all these services.
The Department of Reproductive Health provides specialized services for women, from antenatal care to fertility support, empowering families with informed choices.
So we offer quite a variety of services in our department, but I think what is most attractive is the ART, that is Assisted Reproductive Technologies. And in here we offer quite a number of specialized services. Most commonly is the IVF, that's the in vitro fertilization. We also offer intrauterine insemination. So someone may ask, what is the difference between IVF and IUI? So in IVF, this is where we get the sperms of the gentleman, and then we mix them with the eggs of the lady after she has been stimulated. And then we make the embryo and grow the embryo in the lab. And after that, we implant the embryo back. We transfer the embryo back into the lady's womb, and then she's able to carry the pregnancy. In IUI, here we prepare the sperms of the male partner. We transfer the sperms into the uterus of the woman. We treat quite a number of couples, men and women, who come with different fertility issues. So not everyone will need IVF or IUI. There are some who may just have only hormonal imbalances that we can manage with medication for swallowing or injections. There are some who may have blocked tubes or other pathologies that require surgery. So we also do quite a number of surgeries. And the surgeries may either be open surgeries or laparoscopic or hysteroscopic. We have another arm to the unit, and that's the family planning service. So for us, we deal with women who are trying to conceive, and then also couples who do not want to conceive. So we cover both areas, both ends. So couples or women who want to delay their childbearing, or who want to space their childbearing, or even want to stop childbearing, can actually come and access the different family planning options. In addition, something new we've added onto our menu is the menopause clinic. So you'll find that there are there's a group of women that has been sort of neglected, and those are women who are either in their menopause, towards menopause, or those who have had what we would call premature ovarian insufficiency, and they have a variety of complaints or issues. Some may feel like they don't have energy, maybe their libido is low, they may be dry for women, or they may feel that they're having bone aches and quite a number of issues. You come in, we have our specialists who will sit with you and walk through the management options with you, and then try to get to a point where you can have a better quality of life.
In a neonatal intensive care unit, fragile lives receive round-the-clock monitoring, advanced treatment, and compassionate care from highly trained professionals.
We receive all kinds of sick newborns, but most importantly, we receive their mothers who are termed as high-risk mothers, mothers who, for them, potentially, they may have a poor outcome for their baby. The baby may die or come to be born with abnormalities or anomalies, which we as specialists here are trained to try and see that we mitigate so the outcomes are improved and the baby can survive. So here we have the majority of our admissions are due to preterm babies who are born before 37 completed weeks. So such babies come to us. Most of them are born here, but a small proportion of them are referred already born, but preferably want them to come when they're in utero, when they're not yet born. That way their chances of survival improve. So when we look at our statistics, these babies constitute about 42 to 45% of the number of sick babies that we admit. The rest of the babies that we have are those who are born term but have birth asphyxia, which is also known as HIE in our setting, the babies who get tired at birth. That proportion tends to be more to the babies who are referred to us, needing urgent critical care in form of airway support, which will give us ventilation. But our own statistics for inborn babies with HIE is very minimal. So it means our obstetric team are doing a very good job ensuring that the mothers get due attention and care. So the rest of the proportions of the sick babies we see are those who have sepsis, who have jaundice, who have common neonatal conditions. And the teams here are specially trained to manage these babies in a special way. It's an intricate team of nurses, doctors, biomedical teams. We have occupational therapists, the lab is involved, radiology is involved, so that timely fashion and consciously we manage their complications as soon as possible before they actually cause death or morbidities or disabilities in future.
The hospital's modern laboratory supports timely diagnosis, guiding critical medical decisions with accuracy and precision.
We support the cancer clinics, the mothers, we support the children newly born, we call them the neonates. We support the fertility and infertility clinics. For the cancers, we have cancer markers that we do, a number of them actually, including those for the males, not only for the women, but also for the males like the PSA. We also do for the stomach, we also do for the liver. We do pathology where we check tissues for cancers. We also check fluids, cells for cancers. There's what is commonly called the pap smear. Those are cancers scraped from the cervix and then they are put on a slide and examined for cancer cells for a common virus called human papillomavirus. Then we have hematology. There we check for blood in the patients, the different cell lines, they must be in balance. If they are not in balance, that's why we know there is this problem. Then we have blood transfusion where we have blood that we give to patients who have anemia or who have bled, like mothers who have bled child delivery or even before or after. And even the children. So we support all the different units and we've got state-of-the-art equipment in this laboratory.
Behind the scenes, dedicated support teams ensure that every patient's journey is met with dignity, safety, and care.
We usually work hand in hand with the doctors especially taking care of the babies, monitoring the vital signs of the babies, the breathing rate of the babies. We identify if there is jaundice in the babies. We inform the doctors, and the doctors come and they intervene and tell us what to do. We do everything at maximum, and usually the outcomes are very okay because we have knowledgeable, skilled people here who can give the service. People are passionate, they have good attitude. They are all willing to take care of the newborns.
We care for these small babies as less as 500 grams who are taken care of in the incubators, put on oxygen, but as they transit to breathe well and better, we go to a form of care of keeping them warm, where we put them skin to skin so that they get warmth, they get the love of their parents, and they can feed and grow and live. And that's what we do all the time, and we have the specialty to do it. As they transition from those machines, they have to be cared for in the chest, what we call kangaroo mother care. And this helps them to keep warm, to grow and eat in time. So the parents can easily be discharged. They will bond with their babies. They will have that energy and confidence to care for their babies at home. Like you see, one of our baby here who has grown, was just 500, now 3 years and a half and has gone to school. Just the mother was vigilant. She committed herself, took time, learned what to do, and because of the kangaroo care, she was able to go home with this baby, and that's what we do for the rest of the babies.
Mulago Specialized Women and Neonatal Hospital, advancing women's health, saving lives, and building a healthier future for Uganda.